Hi everyone, my name is Sharna. Our topic for today is alcohol use disorder. This is a very important topic, which this has been affecting a lot of persons worldwide because it negatively affects our physical health, our mental health, and our overall quality of life. Let's get into the topic. Our objectives are define alcohol use disorder, identify symptoms of alcohol use disorder, examine the prevalence of alcohol misuse, recognize health risks associated with alcohol use, discuss treatment and management options. Alcohol consumption is common worldwide. However, excessive and uncontrolled use can lead to serious health and social consequences. Alcohol use disorder is a chronic condition that negatively affects our physical health, our mental health, and our overall quality of life. Understanding the prevalence, the symptoms, the health risks, and treatment option is essential for healthcare professionals that are involved in patient care. Alcohol use disorder. Alcohol beverages contains ethanol, which affects our mood, coordination, judgment, and cognition. Alcohol is classified as a central nervous system depressant and a psychoactive substance. The excessive use may lead to alcohol use disorder or dependence. This chronic condition is characterized by an individual's inability to control drinking habits and to continue the use despite knowing the harmful and toxic effect of the substance. Prevalence of alcohol misuse. Alcohol misuse is a significant global public health concern that contributes to illnesses, injury, and death. Data have shown the size of the problem and highlights the population that is most affected. There are approximately 2.6 million deaths worldwide attributed to alcohol consumption, and that is according to the World Health Organization. Men accounted for 2 million deaths, while women accounted for 600,000 deaths during the same year. Approximately 400 million people aged 15 years and older are currently living with alcohol use disorder, and this is worldwide. It should be emphasized that even low levels of alcohol consumption can increase our health risk, while greater harm is associated with heavy and continuous episodic drinking. The African and European region reported the highest level of alcohol-related deaths per 100,000 individuals. However, alcohol-related deaths globally have decreased by approximately 20.2% as many countries they continue to develop national alcoholic control policies, such as implementing alcohol taxation. Despite the availability of brief interventions and treatment programs, access to screening and early intervention for individuals with hazardous alcohol use remain very limited in many countries worldwide. Symptoms of alcohol use disorder. Alcohol use disorder is identified when the person show two or more of the following signs within a year: drinking more or longer than intended, or being unable to cut down despite wanting to do so, spending significant time drinking, recovering, or thinking about alcohol, having strong cravings or preoccupation with drinking, alcohol use interfering with their work, their schooling, or family responsibilities. The individual continues to drink despite causing social, relationship, or health problems, giving up important activities to drink alcohol, engaging in risky behaviors while drinking, such as driving or unsafe sexual activities, developing tolerance, requiring more alcohol for the same effect, experiencing withdrawal symptoms when not drinking, including symptoms like shakiness, nausea, anxiety, insomnia, rapid heartbeat, feeling unwell, or even having hallucinations. Health risk of alcohol use disorder. Alcohol misuse affects nearly every organ system and contributes to both physical and mental health conditions. The level of harm varies depending on the individual factors and the pattern of alcohol consumption. Alcohol consumption, even at low levels, carries a risk of harm. The degree of risk depends on the frequency of the alcohol consumption, an individual's age, sex, health status, and the context in which the alcohol is consumed. Alcohol consumption increases the risk of developing non-communicable diseases. Such diseases are cardiovascular diseases, liver diseases, and several forms of cancer. It is also associated with behavioral disorders and mental health conditions such as anxiety, depression, and alcohol use. Approximately 4.4% of all cancers that are diagnosed globally are attributed to by alcohol consumption. Alcohol misuse also carries significant injuries and harm to others, particularly through road traffic accidents. Other injuries that are associated with alcohol use includes sexual assault, drowning, burns, intimate partner violence, intentional or unintentional injuries, falls, and suicide. Research have shown that alcohol use contributes to higher incidence of infectious disease, including HIV and tuberculosis. Alcohol consumption during pregnancy increases the risk of fetal alcohol spectrum disorder. These conditions are associated with developmental disabilities and birth defects. Complications may include things like preterm birth, miscarriages, stillborn, and prematurity. Alcohol-related deaths are particularly common among individuals between the age of 20 and 39. Studies have revealed also that alcohol consumption contributes to social problems such as financial difficulties, unemployment, family conflict, and problems at work. Certain individuals and groups may be more susceptible to the toxic effect of alcohol and may be more vulnerable to psychoactive and dependence producing properties of the alcohol. Short-term effects of alcohol use. Short-term effects occur shortly after alcohol consumption. Excessive alcohol consumption may result in injuries such as head trauma. Individuals may display violent behavior or become victim of violence. High-risk sexual behavior may occur, which may lead to unintended pregnancy or sexual transmitted infections. Alcohol poisoning may occur, leading to vomiting, seizures, loss of consciousness. Memory impairment occurs. An individual may misplace personal belongings such as their wallet, their keys, or their phones. Long-term effects of alcohol use. Chronic alcohol misuse can cause serious and sometimes irreversible damage to multiple body systems and significantly affecting our social functioning. Long-term alcohol misuse increases the risk of cardiovascular diseases, causing stroke, liver disease, oral cancer, breast cancer, liver cancer, colorectal cancer, pancreatitis, and neurological damages that affects our memory and cognitive functioning. In addition to physical health complications, there may be persistent alcohol misuse, and this may lead to lots of social challenges, including unemployment, marital separations, domestic violence, and homelessness. Alcohol withdrawal syndrome. Individuals who are physically dependent on alcohol may experience withdrawal symptoms when the alcohol consumption is reduced or it is stopped. Proper assessment and management are essential to prevent complications. Mild to moderate alcohol withdrawal symptoms can be managed safely in an outpatient setting. Before initiating treatment for alcohol use disorder, the healthcare provider should evaluate whether the patient requires management for alcohol withdrawal symptoms. Individuals who present with severe withdrawal symptoms or other medical complications should be referred to the inpatient treatment area where intensive monitoring and care can be provided. Treatment goals for alcohol use disorder. Successful treatment of alcohol use disorder requires individualized care plan that considers the patient's preference, clinical factors, and available resources. These include both pharmacological and behavioral intervention, as well as treatment settings such as outpatient primary care services, specialized addiction treatment programs, intensive outpatient programs, inpatient care, and residential rehabilitation facilities. The clinician should engage the patient in collaborative decision-making when establishing these treatment goals. This process should include identifying individualized objectives, including strategies aimed at reducing harm associated with the alcohol consumption. The selection of medication should be based on evidence-based recommendations while also considering several patient-specific factors. These include the patient's preference, the current alcohol symptom levels, the presence and severity of cravings, the risk of withdrawal symptoms, and the level of social support that is available to the patient. Other considerations include medication formulation, the medical or the psychiatric condition should be considered, such as liver or kidney dysfunction, if the patient is depressed, if they're anxious, if they're using other substances, such as opioid, while they're using alcohol. This may mean that there's going to be a need for additional monitoring or medication. This is going to be influencing your medication selection. Treatment of alcohol use disorder. Several evidence-based treatment options are available for alcohol use disorder. These treatment approach varies because what may work for one individual may not be effective for another. Care may be provided in either the outpatient or the inpatient setting and can be involve specialty programs, therapists, or healthcare providers. Behavioral treatment. Behavioral therapists can refer to an alcohol counseling. It is referred to as like an alcohol counseling or a talk therapy. And this is provided by a licensed therapist, and it focuses on modifying the drinking behaviors of the client. This treatment may include brief interventions, motivational approaches, skill building, strategies to manage the cravings and prevent relapse, and mindfulness-based therapies. Mutual support groups provide like peer support for the individuals who are trying to reduce or to stop alcohol use. Meetings are often available within the communities at little or no cost and may be accessed online. It can also be accessed online. These groups can be particularly helpful in preventing relapse, and when combined with medication and professional treatment, it can provide additional support for recovery from alcohol use disorder. Let's take a look at the pharmacological treatment. Medication-assisted treatment plays a vital role in reducing cravings, preventing relapse, and supporting recovery in individuals with alcohol use disorder. The United States Food and Drug Administration has approved medications for treatment of alcohol use disorder. These medications include acamprosate, naltrexone, and disulfiram. Gabapentin and topiramate are also medications supported by clinical evidence. These medications are available in oral formulations, and naltrexone is available as an extended release intramuscular injection. Emerging researches suggested that hallucinogen substances such as psilocybin and dissociative agents such as ketamine, when combined with psychotherapy, may reduce a number of heavy drinking days, and it may increase the number of alcohol-free days. Follow-up. Ongoing monitoring and reassessment are essential component of managing alcohol use disorder and supporting long-term recovery. The treatment goals should be continuously be evaluated and maintained. If a patient is taking a composite and naltrexone and they continue to consume alcohol, the medication should generally be continued while the healthcare provider reassesses the treatment plan and modifies the goal as necessary. Visit should be provided on a 2 to 4 week basis. There should be ongoing screening for depression, anxiety, and suicide risks. There should be monitoring for withdrawal symptoms and risk of relapse. And the patient should be encouraged to do therapy and group support, to continue to do therapy and group support. In conclusion, alcohol use disorder is a complex and chronic condition that can significantly affect an individual's health, relationship, and overall quality of life. Excessive alcohol consumption contributes to a wide range of physical illnesses, mental health disorders, and social problems. Early identification of the symptoms and proper screening are essential in preventing the complications and reducing the burden of alcohol-related harm. Effective management includes a combination of pharmacological treatments, behavioral therapy, and support system that can help the individual to reduce the alcohol consumption and maintain recovery. Health professionals play an important role in reducing patients, providing an appropriate treatment option, and also ensuring continuous follow-up to support long-term recovery and improved patient outcome. We've come to the end of our presentation, and I thank you for your attention.